Welcome back. Researchers at Mayo Clinic have teamed up with a tech company to create AI that can detect COVID-19 based on your voice. WCCO's Liz Collin has more.
The body sends us a lot of signals that we're not paying attention to.
As Director of Cardiovascular Research at Mayo Clinic, Dr. Amir Lehrman believes we are just beginning to understand what he calls a new era in medicine, one that artificial intelligence is making sense of.
When we talk about voice, it's not exactly what you and I can hear. A voice is a spectrum of a lot of frequencies.
Case studies at Mayo Clinic have honed in on those frequencies, identifying certain vocal biomarkers to screen and detect patient health, from pulmonary hypertension to dementia, depression, and now COVID-19.
We try to use the same element of voice recognition to define if you can actually enhance your sensitivity in detection individuals with COVID.
Our early data indicates that we actually have a signal in both symptomatic and asymptomatic patients.
Tal Wenderow is president and CEO of Vocalis Health, an Israeli medtech startup using AI algorithms to screen, manage, and predict healthcare. Listen to the voice demo that walks you through its COVID screening.
Now you're asked to click here and count from 50 to 70.
We transform the voice from the voice domain to the image domain.
50, 51, 52, 53.
And then every voice that comes, we translate to an image and we compare and we look at that correlation.
Vocalis is currently working with employers in Asia as they look for ways to bring their employees back safely.
And it returns a result. Thankfully, my result today is low, and I'm cleared to come to work.
While it may sound like something from the space age, Vocalis says it comes at a time contactless care is critical. And for us all to think back on how many times we've said this before.
You don't sound so good today. That's what we're trying to quantify and standardize and use that as a tool in the healthcare toolbox.
Liz Collin, WCCO 4 News.
Once this COVID screening is published in a peer-reviewed journal, Mayo hopes to begin using it too. In another innovation to come out of the pandemic, the FDA has approved emergency use for a COVID-19 test that can be done at home. The nasal swab test can provide results within 30 minutes and is for use by anyone aged 14 and over if their healthcare provider suspects that they may have COVID-19. The test involves swirling a patient's self-collected sample swab in a vial, which is then placed in a test unit. Results are then made visible on the test's light-up display within 30 minutes. And an ongoing study suggests diabetes and high blood pressure may increase the risk of COVID-related brain complications. Researchers with the University of Pennsylvania looked at brain scans from 81 COVID-19 patients. Of those, 18, or about 1 in 5, had critical complications, including strokes or brain bleeds. At least half of those patients had a history of high blood pressure and/or type 2 diabetes. 2/3 of the critical patients were African American.